بسم الله الرحمن الرحيم. Inflammation is a protective tissue response to injury or destruction of tissues, which serves to destroy, dilute, or wall off both injurious agent and injured tissue. It is manifested by local tissue damage, vascular reaction, and local reaction of tissue histiocytes. Inflammatory response may be provoked by acute inflammation is a rapid response to an injurious agent that serves to deliver mediators of host defensive leukocytes and plasma protein to the site of injury. It has three components: alteration of the vascular caliber to increase blood flow, structural changes in the microvasculatures that permit plasma protein and leukocytes to leave the circulation, immigration of the leukocytes from the microcirculation, accumulation in the focus of injury, and activation to eliminate the offending agent. As for chronic inflammation, it is an inflammatory response of prolonged duration, weeks, months, or years, provoked by the persistence of causative stimuli, simultaneous presence of acute inflammation, tissue destruction, and repair. Chronic inflammation characterized by mononuclear inflammatory cells, tissue destruction, repair, fibroblasts, endothelial cell proliferation, which is angiogenesis. The dominant cellular player in chronic inflammation is the tissue macrophages. Blood monocytes migrate into tissue within 48 hours after injury and differentiate into tissue macrophages. It is joined by lymphocytes and plasma cells. However, mast cells and eosinophils are well involved in the chronic allergic reaction. As you can see, these are the lymphocytes and the plasma cells. The sequence of cellular infiltrates in acute chronic inflammation. Acute neutrophils appear first, followed by macrophages. Simple chronic inflammation, lymphocytes in greater numbers, followed by plasma cells and macrophages, while in granulomatous chronic inflammation, macrophages clusters, followed by peripheral lymphocytes and smaller numbers. What are the types of inflammatory cells? Inflammatory cells include neutrophils, which is called polymorph nuclear leukocytes, the main effector cell to mediate effect in acute inflammation. Most prominent inflammatory cells in foci of acute inflammation during the first 24 hours. It is a diagnostic hallmark. Main cell accumulating in the extracellular space. Important causes of neutrophilia is bacterial infection and infarction. The second type of cell is macrophages. It is a minor component of chronic inflammatory of acute inflammation, while it is the most important role has a most important role in chronic inflammation. Derived from monocytes in circulating blood, which migrate into the damaged tissue area after neutrophils. So at first it's neutrophils followed by macrophages. It has a phagocytic effect and powerful systems to kill bacteria. Survive much longer than neutrophils since they have oxidative metabolism. Also secrete growth factors and cytokines and assist in repair of damaged tissue. For acute inflammatory response, lymphocytes are most prominent inflammatory cells in viral infection, combined with monocytes, macrophages, and plasma cells to be the most prominent cells in chronic inflammation. Lymphocytosis, which is increased number of lymphocytes in the peripheral blood, most often caused by viral infection, as influenza, mumps, and rubella, certain bacterial infection as whooping cough and TB. As for eosinophil, it is a prominent inflammatory cell in allergic reaction and parasitic infection. Important eosinophilia causes in cases of allergy like hay fever, asthma and hives, parasitic infection, polyarthritis nodosa, and Hodgkin lymphoma. Mast cell and basophils, source of histamine, important basophilia cause chronic occur in chronic myelogenous leukemia and other myeloproliferative disease. So, what is the difference between acute inflammation and chronic inflammation? Acute inflammation occur in pulse of injury, but chronic occur in persistent injury. Once is abrupt, well defined, the onset. The other one is vague onset. Prominent symptoms. Symptoms are often subdued and or insidious. Prominent vascular effect and exudate, mild tissue effects. Exudates are neutrophils. As for chronic inflammation, exudates is made both lymphocytes and macrophages. Connective tissue proliferation occur after inflammation subsides in acute inflammation. As for chronic inflammation, connective tissue proliferation is concurrent with ongoing inflammation. Granulomatous inflammation is a chronic inflammatory reaction dominated by macrophages, epithelioid cells, or multinucleated giant cells. It has a principal cells, macrophages, and lymphocytes. What is the meaning of granuloma? Granuloma is a focal area of granulomatous inflammation consisting with epithelial-like cells surrounded by a collar of mononuclear leukocytes, principally lymphocytes and occasionally plasma cells. Fibrous connective tissue often surround granulomas. The lesion can be small, from 0.5 to 2 mm, confluent, and may be quite large. Granulomatous inflammation, essential component, macrophages and epithelial cells, as I told you before. Epithelioid cells can form multinucleated giant cells. Epithelioid cells are surrounded by collar of lymphocytes and occasionally plasma cells. Fibrous connective tissue often surrounds granulomas. Remodeling of tissue. Area within the granuloma can undergo necrosis. Necrosis can lead to calcification or liquefaction and formation of a cavern if drained. Examples of granulomatous inflammation: TB, foreign body aspiration, and brucellosis. This is a mononuclear leukocytes. The nucleus is divided into lobes connected by strands of chromatin. Intracytoplasmic granules encasing lysozymes specializing in phagocytosis. This is the mononuclear leukocytes. As for eosinophils, it is the nucleus composed of two lobes. The toxins from the granules are important for killing parasites, but in asthma, they are released inappropriately and damage the lining of the air passage. As for basophils, large cytoplasmic granules which obscures the cell nucleus, as you can see, contain anticoagulant heparin, which prevent blood from clotting too quickly, contain the vasodilator histamine, which promote blood flow to tissues. As for monocytes, can move quickly to sites of infection in the tissues and divide or differentiate into macrophages and dendritic cells to elicit immune response. Large bilobated nucleus. This is lymphocyte which is predominate in chronic inflammation, a large dark staining nucleus with little to no eosinophilic cytoplasm. It is impossible to distinguish between T lymphocyte and B lymphocyte in the peripheral bloodstream. This is the Langerhans giant cell, formed by the fusion of macrophages, contain nucleus arranged in the horseshoe-shaped pattern in the cell periphery, could indicate TB or other mycobacterial infection. This is the Teuton giant cell. The Teuton giant cell is a lipid-laden histiocytes in which multi-nuclei are grouped around a small island of the cytoplasm, characterized by xanthomatous reaction. As for foreign body giant cells, a collection of fused macrophages, giant cell which is degenerated in the response to presence of large foreign bodies. The nuclei are arranged in a disorganized manner. In contrast to Langerhans giant cells, the nuclei around are arranged on the border of the cytoplasm. This is the plasma cells, Russell bodies, as you can see from the arrow. Plasma cells produce large volumes of antibodies. Basophilic cytoplasm, eccentric nucleus with heterochromatins is in a characteristic cartwheel or clock face. These are the Russell bodies, xenophilic large homogeneous immunoglobulin containing inclusion usually found in a plasma cell undergoing excessive synthesis of immunoglobulins. This is a clean corneal wound healing. These are some types of stains used in routine diagnostic histopathology. I will tell you about what is most common in ophthalmology. These include many stains. This table. As for Elcham blue, it stain mucopolysaccharides blue in cases of macular dystrophy of the cornea. As for colloidal iron, it stain mucopolysaccharides blue also in macular dystrophy. As for gram stain, it's one of the most important stains, which stains the bacteria, differentiating cell wall staining. Gram positive microorganism is by dark blue. Gram negative is stained red. It is used for identification and classification of bacteria. Mason trichome is used for staining of the epithelium red in cases of damage to the Bowman layer, and it stains connective tissue green in cases of fibrous metaplasia of the lens. Periodic acid chef stain is one of the most important also. It stains the basement membrane bright pink. The cornea, if in cases of epithelial basement membrane or basement membrane or descent membrane. It stains the capsule of the lens. It stains inner limiting membrane of the retina and other fungal elements. Persian blue or pearl stain. It stains ferrous and ferric iron, dark blue, used in iron-containing salts and blood products, metallic foreign body, and hemorrhage. Van Giesel stain elastine, muscle, it stain muscle yellow and connective tissue red. Giant cell arthritis to demonstrate the fragmentation of internal elastic lamella. Zil-Nelson stain is also very important. It is acid-fast stain, acid-fast bacilli as Mycobacterium and Nocardia. Identification of acid-fast pathogens in inflammatory tissue. This is an example that show in macular dystrophy of the cornea mucopolysaccharides accumulating in the endothelium and in the keratocytes. The best way to demonstrate the presence of mucopolysaccharides, colloidal iron or Elchian blue. Both are present in this photo. This is azurine red stain is used to identify calcium salt used for calcified bone spicules in osteosarcoma. Myelin sheath demonstrated Lopez stain. This is used for tobacco or alcohol amblyopia. The center of the nerve is pale, axial demyelination. Mason trichrome stain is used for corneal dystrophies. Also, formation of the anterior subcapsular fibrous plaque is in one complication of anterior uveitis, staining by Mason trichrome stain. This is by comparison of hematoxin and eosine stain in the left and periodic acid Schiff stain in the right. It is used to demonstrate basement membranes. An immunosuppressed patient who get TB, acid-fast organisms stained by Zil-Nelson stain were plentiful in choroidal microabscess. This is the inflammatory cells, lymphocytes, and plasma cells, as you can see. Thank you.